I'm Benjamin Hill with Mission Physical Therapy. I'd like to talk with you a little bit about some tools that you can use at home to decrease your muscle tone or tension, get rid of some trigger points or what some people call pressure points. One of my favorites is actually a lacrosse ball. It's about the size of a tennis ball or a racket ball, but it's got a more dense feeling to it. It doesn't give as much under pressure, and so you don't have to push very hard, and it's kind of got a stickier feel too, so it kind of stays put. My favorite place to use it is not on the floor like you'll see a lot of people do, because it's a lot harder to control the pressure, and it's harder for some of my patients to get up and down from the floor. So I usually suggest people, especially in an office setting, you don't want to get on the floor there, but you take that ball out of your desk and you put that up against the wall and pin it right against an area where you feel like you need it. It's pretty intuitive. You put it right on those tight and tender muscles, not on bony surfaces like the middle of your spine or the point of your shoulder or something like that, but on the meatier areas of your body where your muscles are tight. If you lean into that ball against the wall, you'll feel some pressure there. You want to have what some people call a good hurt. You want to have some discomfort for it to work, but not so much that you can't relax. Okay, so thinking back to what I've talked about in the past about stretching, you don't want your muscles fighting you. You want them to submit, you want them to let go and relax so you can get some blood flow into that area. So if there's too much pressure, bringing your feet closer to the wall will reduce it. And if there's too little pressure, putting your feet further away, which makes you lean into the wall more, will increase that pressure. So you can get it just right. You can then hold that ball on that spot for 30 to 90 seconds, or you can put it on that spot and then try some slight oscillatory movements up and down or side to side depending upon the direction of those muscles, and you may find that to be more effective. If it's in an area of your back that you can't reach so well, you might try putting that ball into a long tube sock or stocking, and then you can drop that down behind your back and find that you can reach it a lot more easily. I love using a ball for both upper quarters of my back, behind your shoulder blade, in between your shoulder blades and along your spine. There are two channels of muscle going up and down your spine, the rectus spinae muscles. The low back, of course, as well as the back side of your hip. It's also a great tool to use on the arch of your foot to hold some good pressure on there or to roll it across the arch of your foot. Some other balls that people like to use are training balls, which they might use in t-ball, or you can simply try a tennis ball or a racquetball, but my favorite is probably that lacrosse ball. I'm Benjamin Hill with Mission Physical Therapy.